All right, now let's take a look at what we would like you to achieve by the end of the rotation.
We have 4 major goals during your rotation: independent triage, understanding community systems, team leadership and education, and pediatric consultation.
Here's how we're going to get this done.
Senior residents carry the pager during the day and receive all admission phone calls. This allows you to triage patients independently and think through the case. After this, please call your hospitalist, the primary care physician, and the charge nurse to discuss the case and determine if it can be admitted here. After hours, for any patient that you are concerned about, your backup hospitalist is always available to come in from home. In addition, the ER physicians, the adult ICU physicians, anesthesiologists, and neonatologists are always in-house to help you. Many of our primary care pediatricians can admit to our floor, and all of our PCPs desire communication at both admission and discharge. When admitting a patient, please discuss whose service the patient will be on and how to contact the primary care physician with the hospitalist. Some PCPs like to be called, others like epic messages. At discharge, have the patient and family teach back to you when and where their follow-up appointment is, all their medicines and when and how they're going to take them, and any indications to return to the emergency department. Also, contact the primary care physician with a summary of the discharge. 24 to 48 hours after discharge, please call the family to ensure that they have had a smooth transition of care back to the outpatient world. Document this telephone encounter in Epic. As the senior resident, you will lead family-centered rounds. Here are some tips to help this go smoothly. First of all, please prepare the families prior to round starting so that they know what family-centered rounds is. Also, discuss your plans with your students and interns before rounds start to make sure you're all on the same page. If you feel comfortable, you can have the presenter present to you on rounds, and the attending can observe and give you feedback on how you run the team. Lastly, pick one teaching point or exam finding to teach about per patient. You are also expected to observe and give feedback to the learners on different skills. For H&Ps, if you observe and are present, you can addend the student note and it can be used by the attending for billing. Also give feedback on presentation skills, notes, and orders entered by the student and intern. And lastly, team dynamics on things such as communication. Our nurses like to be involved in our patient care, so please update them promptly on things such as new orders or changes in patient status. In addition, here are some topics that we like to try and cover through patient care and lecture during the rotation. These are great topics to teach about if you have downtime or to read about when you're at home. All surgical pediatric patients are admitted to the hospitalist service with surgery as a consult. Daily communication with the surgery team is expected. If the patient is less than 5 years old, pediatric surgery will be the consultant, that's Dr. Mack's team. If they are 5 to 10 years old, then trauma surgery will be the consultant. And if they're greater than 10 years old, it will be either trauma or general surgery as the consultant. At nighttime, you may be called for a pediatrics consult, either from the ED or from the floor for orthopedics or an ENT patient. These consults are generally staffed with the hospitalist attending.
Woo! That's a lot of stuff, but we can do it. May the force be with us. Please proceed to the last video, evaluation, feedback, and teaching. Almost done!